All right. Well, hello, everyone. Welcome and thank you for being here today for our bone and blood marrow transplant survivorship panel. Please definitely continue to eat your lunch and enjoy our session. We really want this to just be an engaging 45 minutes to be able to hear from our panelists and allow you to be able to ask questions of this incredible group that we have up here today. So very quickly, my name is Erica Ripken, and I work for NMDP, formerly known as Be the Match. Our world headquarters are here in Minneapolis, and I've worked for the organization for 17 years. I'm a senior clinical operation partner, and really what that means is I'm that relationship manager for 5 states and the transplant centers within those states. So the University of Minnesota is actually one of my transplant centers that I do work with. And it's an honor to be able to be here today at the Survivorship Conference, and I want to thank you for stopping by at the booth too. It's been fun to have some engaging conversation today. So I'd like to introduce our panelists today, and I'm going to allow them to share a little bit more about themselves in just a brief moment here. But we have Heather Brown, Eric Schutter, and Steve Buechler, and I'm going to allow the 3 of them now to do some introductions. So I'll start with Heather.
Nope, it wasn't on. Okay, now I'm talking. Hi, guys. So I am Heather. I am a licensed marriage and family therapist. The reason I am up here is because I had a bone marrow transplant back in 2018. So May of 2018. I'm bad at mental math, so I'm not going to be able to tell you. I'm coming up on an anniversary, May 2nd. So kind of my story, I was actually originally diagnosed with breast cancer back in 2016 and went through the treatment with that, was in the process of, because I had been diagnosed at such a young age with breast cancer, my doctors wanted me to continue to do some treatment after I was done with like the big heavy treatment, and was doing what I was doing. I don't have to explain to you guys what immunotherapy is. You guys all understand all these words. A lot of times I have to like give context for what I was doing, but you know it. So I was going through doing immunotherapy, went in for treatment one day, and my doctor said, "Hey, we're not going to do treatment today. Your blood work came back weird." And I was like, "Weird? What do you mean by weird?" And she said, "Well, we think you have leukemia." And I was like, "Oh, crap. Okay." So then that kind of led me into, that was January of 2018. And then we kind of bounced around on what we were going to do as far as treatment goes. And ultimately decided that a bone marrow transplant was going to be our best option. Because I had had so much chemo with breast cancer, they said, "We're going to have to modify your treatment plan too much. I think we do the bone marrow transplant." So I went through that. Within all of that, kind of realized that I needed to do something different with my life, and decided that once I was back to being healthy, that I wanted to switch careers and go into marriage and family therapy. So January of 2019, I signed up to start school and have been on this journey of becoming a licensed marriage and family therapist, officially licensed January of this year. And my passion now, hey, thank you. It was really exciting. It was a long journey. But yeah, my passion is to work with people who have been through cancer and supporting people in that. I have seen the impact mental health has had on cancer survivors, and I know the struggle of trying to find a therapist who understands it and connects with it, and so that's what really drove me to do what I do today. So that's a little bit about me.
Hi, I'm Steve Buechler, and I'm going to try and condense 5 months of treatment into 5 minutes of summary. If only it had gone that fast. And I'm going to follow a script because I'm a recovering professor, and if I don't follow my script, it'll be a half-hour talk, and you don't have the time for that, so we'll try and give you the short version. My story starts a little earlier than Heather's. In May of 2016, I went in for just a routine physical. I had no symptoms, I had no complaints. I almost canceled the appointment, but I kept it. Then they did some blood work that showed my white blood cell count was dangerously low, so they referred me to a hematologist. The hematologist recommended a bone marrow biopsy. The bone marrow biopsy found acute myeloid leukemia with about 50% blasts in my bloodstream. So in about 17 hours after that, I was hospitalized for what proved to be a 37-day hospital stay for what was then the conventional induction treatment of 7+3. It's a week of cytarabine and 3 days of idarubicin. It took a month, but 1 month later, I was in remission, and I was just waiting for some test results of the cancer to guide further treatment. And what they told me is if the tests come back and you have a favorable risk profile, you can probably get by with just more chemotherapy. If it's an adverse risk profile, you'll probably need a stem cell transplant. So I took some comfort in the idea there would be a clear fork in the road. Depending on the test results, I do this or I do that. The test results came back and they said, well, you're in an intermediate risk category. And I said, what does that mean? And they said, well, that means you have a tough decision to make because there's no obvious fork in the road to take. That led me to a consultation with the University of Minnesota transplant people. I went back to my community oncologist, but no one would give me an explicit recommendation until my wife asked my oncologist, if Steve was your husband, what would you want him to do? And she immediately said, get a transplant. So that planted the seed. I did some research on my own, I did a lot of thinking, and ultimately my logic was if I did the chemotherapy route and it didn't work out, I'd always regret not getting the transplant. If I did the transplant and it didn't work out, at least I would feel like I gave it my best shot. So I threw my head into the transplant option. Now we needed a donor, and I had come from a small family, so they just tested my one younger brother, and he was a half match with me, which meant he was a workable candidate for a donor, but maybe not ideal. And then my doctors suggested they could also look at umbilical cord blood as a possible donor source, which I'd never heard of. It sounded like science fiction to me, but they convinced me it was a viable option. So again, I said, okay, you're the experts, which is better? And they said, we don't know. In fact, they said, we have a clinical trial to figure that out, and if you want to jump in the trial with a bunch of other people, in 5 years from now, we'll probably have a better answer for you. And since I had no logical basis for distinguishing between chemotherapy or transplant, I said, okay, put me in the trial. And they called back the same day and said, we randomly assigned you to the cord blood option, or cord blood arm of the study. So my brother was off the hook, and my life would depend on a mother and perhaps a father somewhere in the world who had the foresight to donate their newborn infant's umbilical cord to a blood bank where it was genetically typed and frozen until someone like me came along needing a donor. Meanwhile, a lot of time had gone by, so I went back in the hospital for some consolidation chemotherapy, did that for a week in August. That crashed my platelets and led to some uncontrollable bleeding, so I went back in the hospital for a week of platelet transfusions. I got to my transplant eventually on October 20th here at the U. I was discharged 17 days later, which was a little earlier than they told me to expect. But the next day I came back to clinic, they did a bone marrow biopsy, and they said, one of your 2 cord blood donors is 99% engrafted 3 weeks after transplant. What followed was a gradual recovery through the first 100 days. There were many appointments. They gradually tapered off. But I'll always remember at the 6-month mark post-transplant, I went to see my transplant oncologist and everything looked good. And I said, when do you need to see me again? And she sort of shrugged her shoulders and said, maybe 6 months. And that's when I knew I'm at the beginning of possibly being in the clear. And she cut me loose at that point. I still keep up with my community oncologist for checkups, but everything has been good. I was off all medications within the first year. Redid my childhood vaccinations at year 1 and year 2. And looking back, I think I can say I hit the treatment trifecta. I got into remission on the first attempt, had full donor engraftment within 3 weeks, and no graft versus host disease. I tried to do the numbers on that and multiply the percentages of independent events like they tell you in statistics class, and I think it's below 10% that all those good things happen at once. And I've been told I can consider myself cured, and I'm in good health ever since, except for all the things that plague us 73-year-olds. I won't get into all of that stuff, but none of it is life-threatening. And as a result, I don't have any survivor's guilt, but I have a survivor's obligation to give back. So I do a lot of volunteering. I've written a couple of books. I'm very active in the cancer community because when you acquire this skill set and this knowledge base, you better damn well share it with people. So I'm happy to be here and do that. And I wanted to keep this short because I want to take your questions and respond to what's of interest to you rather than me going on with my story.
Hi, I'm Eric, Eric Schluter. I'm was asked to be a panelist to kind of present from a caregiving perspective. My wife had a transplant, bone marrow transplant in 2016. She had an underlying health condition, which is like a childhood illness, Fanconi anemia, and that brought her to transplant as an adult. And I was her primary caregiver for 13 years. So FA leads to a lot of other ailments, a lot of other polychronic medical conditions. So early on in her journey, it was more facilitating doctor's appointments, coordinating with insurance, doing that type of activity. As her journey progressed, I was more involved in a caregiving role. During transplant, I did a lot more advocating, speaking on her behalf. Chemo and radiation for my wife just challenged like her ability to retain information and articulate things that were going on in her own health. So I was able to do that on her behalf. You know, my wife did pass away here about a year and a half ago. I volunteer a lot with the University of Minnesota, the Negative Space, which is they've got a exhibit out front. Jack's Caregiver Coalition has a group out there as well, an exhibit out there. I also volunteer for the Minnesota Cancer Clinical Trials Network. Melissa's bone marrow transplant would have not been successful had that clinical trial work not happened like 10 years or 20 years prior to her needing that transplant. FA brought a whole bunch of different complications that they couldn't treat with traditional chemo drugs like you would use in like AML or leukemia or other types of transplants. So yeah, I like to give back. I like to help out. Melissa did a lot of donating. That was like her time. She liked to donate her time and her even her cells she donated. So she had, I don't know, 24 bone marrow biopsies through her journey. And the doctor always needed like 1 or 2 for her testing, but she always donated like 3, 4, 5, depending on what the doctor needed at the time. So I thought, well, I can give back and volunteer and just share my story. And as a caregiver, there's a lot of things I wished I would have known earlier on in my caregiving journey that I'd like to be able to share and get out there with whomever's interested in hearing it. So thanks for having me.
All right. Well, thank you all for being able to share your story. And I want to be able to open it up to the room to be able to ask our panelists some questions today. For those that are online, please you can enter your question in, and then Sharon will let me know so that we can also make sure that your questions get answered as well. So right now, what I'm going to do is I am going to walk around the room because I do need you to be able to share your question through our microphone. I can also help with that as well. So any questions that you have for our beautiful group up here? Great.
Hi, I was just wondering, I'm a nurse that takes care of bone marrow transplant patients. It's pediatrics over at the U at Masonic. And I was just wondering, what is like one thing you guys would have really appreciated from our side that we could do for you during that process? Because I know we try to do everything we can, but sometimes just like one little thing would make such a difference.
I'll start from a caregiving perspective. If the providers, if the nurses could also acknowledge and see the caregivers, I think that would go a long way. In BMT on the adult side, you're on the 5C unit, so you get like the whole unit on the adult side. They're very, very accommodating to caregivers. You know, Melissa's journey was all pre-COVID, so I don't know what it's like post-COVID. But I mean, you could stay on the floor, and they had refrigerators and stuff for you to use. But yeah, just recognize the caregivers are there too.
Thank you, thank you, thank you, thank you. pass that on to all the rest of the nurses too. I had a terrific experience and relationship with the nurses. They were very supportive. Every time I reported a side effect or a concern, they were on it. The doctors made the rounds. It was about as pleasant a stay as you can have when people are doing what they're doing to you. They encouraged me, and I was already pre-inclined to do a lot of exercise. I did yoga in my room. I really can't criticize or ask for anything more unless, can you do anything about the food? They actually explained to me at one point, I complained so much that some official person came to my room and they explained at that time, apparently, Fairview had one call center for all of their hospitals, and when you called in a food order, you were competing with every hospital in the Fairview system, which explains the 2-hour delays and the fact that the orders got mixed up, and I kept getting this guy's tomato soup that I didn't order, and I didn't get the stuff that I ordered. But if that's my biggest complaint, that tells you how great the nursing service was and staff. So I'll go back to where I started with thank you, and please pass it on.
Yes, I will echo that. I very much loved all of the nurses and the doctors and the support that we got in there. I think for me, what I noticed, when you are living in the hospital and you're there day in and day out, it can sometimes get exhausting to share your story. So when I would, I had my usual nurses that I would see on rotation, and they would just check in, but then we would get new nurses that would want to hear your story. And sometimes it was like, this is the 4th time I've shared my story today. And I would find that my patience was a little bit short with them. And it wasn't that I didn't care, but I didn't care to share my story for the 4th time that day. The other thing that was huge for me was, I can't remember who shared with me, but they were like, so for me, when I was in the hospital, my son was just about 3 years old. So I would always FaceTime with him at night at dinner time, and we would have, the nurses come in to do the rounds, and they're wanting to check my vitals, and I'm like, I'm trying to talk to my kid on FaceTime. I don't want my vitals done right now. So somebody shared with me, like, put a sign on your door. If you don't want us in, let us know that. And so being able to work with the nurses, and it was probably a nurse that told me to do that. And that was huge, to have a little bit of control in a time where I felt like I had very little control. And I was able to create a space where I could say, no, this is my time to hang out with my family. This is my time to connect with people. And being able to advocate for myself was huge in that. So that would be my feedback. But yeah, you guys are awesome, and we couldn't do it without you guys. And the amount that the nurses advocated for us too, and even kind of went to bat with the doctors sometimes, because I often would leave my room when the doctors were doing rounds and they'd get mad, and my nurses were like, no, you go for that walk. You don't worry, the doctors will come back and find you. So what you guys do is awesome. So thank you.
I'll second that, because I became an inveterate hall walker, both at my initial hospital, which was Methodist, and also at the U of M. And the walking was good as physical exercise, but what I realized as I wandered around is that I would see nurses and staff in all parts of the ward, and there was almost always a smile and a wave and a welcome, even though you didn't have to do that. You weren't taking care of me, but nonetheless there was that feeling. And not to fixate too much on the food, but small things can tell you something. I can remember nurses slipping me passes to the cafeteria, saying, here, go on up there. And I would take advantage of that. And at least the food was hot. And you overlook the time when my wife smuggled in a key lime pie and sort of let that pass. And so you recognize us as people and not just diagnoses. And that makes a huge difference when you can have a whole person relationship. So again, thanks for that.
All right.
Hi, I had my transplant in 2015, so coming up on 10 years. One of the things I ran into as you talk about caregivers was I'm single, no kids. My parents were long gone. And so when I had to have somebody be there for 100 days, my sister stepped up, but she didn't qualify for FMLA. for her job. So she had to get 3 approvals from her company. She works for an airline, her station, her union, and the corporate headquarters to be able to take her sick time to be my caregiver. Because FMLA doesn't apply to siblings. So I'm curious what, you mentioned you work with a organization, sorry, I don't remember your name, that provides caregiving help. So I'm wondering if you've ever encountered things like that in that organization, and if they have like solutions to find a caregiver that somebody can take time off of their job to those 100 days, right? That you have to have somebody with you 24/7.
Right. No, great question. The Negative Space is one of nonprofits in the St. Paul area here that are building a huge community of resources for caregivers. Jack's Caregiver Coalition is another one. Jack's is very unique in that they do provide services for both men and women, but it's largely focused on guys because guys don't usually ask for help. Guys have been very much raised to just, be the heroes of the story and don't ask for help, just grin and bear it, just do it. So that organization has been instrumental in just trying to change that narrative and just get guys help that they need. For me, when I went through that portion of Melissa's transplant, I was a telecommuter at the time, so I had an opportunity to work from home. But it was a significant change in my work direction. I'd given up a work advancement and took a different role, but I was able to keep my job. So work was very supportive for me. So. Yeah.
I do a number of peer consults through what used to be the Match. Sorry, Erica. NMPD is the new name, and LLS. And one of the saddest phone calls I have is when I talk with a patient who says, I've been cleared for transplant, but I can't line up the caregivers. And the transplant unit, we can't do the transplant if you don't have caregivers. And the sociologist in me is well aware that for the vast majority of human history, we lived in extended family kinship networks, and there were always dozens of people around that could take care of you. And we don't have that kind of society anymore. And I've talked to patients who are not able to get a transplant because they can't line up the caregivers, and that's how important it is. In my case, I needed very little from my caregivers, but they provided a lot. I mean, they drove me to clinic visits. Other than that, there were no emergencies. So we got reacquainted and played a lot of pinochle and sheep's head, and it was a party. But if you have an emergency, you need that person there, and they need to be there 24/7, and I can understand why they won't do a transplant if you don't have that support lined up. And it's a common issue. And the FMLA issue you raised would be one good starting point among many others.
I don't have a lot to add on this one, sorry. I was fortunate that we were able to line up caregivers. We got creative and had friends, family, and tried to kind of circle several different people through just so that it wasn't a burden on one person to have to be there all the time. And so, yeah, I don't have a lot of, I guess, advice or recommendations for if you don't have that support. But I can imagine how challenging it would be to not have that. Because, like I said, we had a vast circle of people wanting to step up and help. And there were even times there where it was like, okay, this is a lot. I mean, that 100 days is a hard chunk of the bone marrow transplant. So. Mm-hmm.
I did have to get a little creative myself because my wife had her own physical issues and was in the early stages of what became dementia. So my roots are in Wisconsin, so for the first 5 weeks at home, I lined up a rotating schedule of my brother came for a week, an old college friend came for a week, my brother came back for a week, my college friend's wife came for a week, my brother came back for a week. That's only 5 weeks. And I kind of ran out of that resource, so I started recruiting local people. And by about day 60, I ran out of people to drive me to clinic. So I started driving myself, despite the prohibition on doing that. And I told my oncologist, and she rolled her eyes and said, I didn't hear that. But you do what you have to do. But by that point, I knew how my medications affected me. I knew not to take voriconazole before driving because it blurs your vision, so I would hold that till I got back home. So I became pretty self-sufficient. But you don't know that going in. You have to follow that advice about have a caregiver, and if you don't need them, that's great. But that's much preferable to needing them and not having them. So again, I respect the requirements, but it's hard to find the social fabric to support that for everyone, no doubt.
All right, I know there's a few people back here, so I'm going to go with you, and I know we have one online too, and I know you raised your hand. I think we had one over here too.
So this is a question for Steve. I had my BMT back in 2010, and it was also with umbilical cord blood. I had a really hard time afterwards having to get like my shots all over again, being that it was baby's blood, so I had to get all my boosters and everything all over again, which didn't make a lot of sense to some of the doctors in my area where I had to go get them done at. So I'm just curious if you also had those issues. And another question is, mine was from Belgium. Do you know where yours was from?
The first question, that was all taken care of here at the U of M. So they have a regular routine where I would come back at year 1 for dead viral sources and year 2 for live viral sources, and they just took care of it. And at that point, my care transitioned back to Methodist Hospital, and I still see my oncologist there. So it was a pretty smooth transition from what they did here to follow-up care there. And I do not know, and apparently I will never know where my donor came from. At first they said we're not sure we could even track it, but I guess technically, legally, my donor at the time, and still, it was a minor, considered a minor, so they can't share that medical information. So even if there was a way to track it down, there's no way I could do it. So whenever I come across a pregnant mother who's about to make that donation, I just thank them profusely. They're right up there with the nurses in terms of people I owe my thanks to. And I'm a little sad that it's kind of gone out of favor of late. It's a little expensive to preserve those things, but I certainly have no argument with it as a treatment. That clinical trial I was in, 5 years later, it showed that there might be a slight benefit to the haploidentical half-match sibling as opposed to the cord blood, but it was not always statistically significant, so it's still a pretty close match. But I was an N of 1, and I made it, so I'm happy with cord blood. I know we have more questions in this.
Great, I'm going to grab over here, and I'll make sure I follow that.
So for those of us that have had stem cell transplants, allogenic, I want to know, is your blood type now different? Did your doctor specifically give you a different blood type? Do you know?
I don't even know for a fact, but I think that tells you it's not that significant.
Well, it is, because I never grafted then 100%, and I'm 5 years out. So that's why I'm curious in asking this. So I'm considered a chimera. And I'm just kind of wondering if this happened to anybody else with this and if they do it a lot.
I got a allogenic stem cell transplant, and my blood type did change.
And did it go 100% fully?
Yes.
I'm assuming mine changed completely too with 100% engraftment. But I do know I still have 2 DNA sequences in my body. So the DNA in my blood is different from the DNA in my saliva. There's like the original and the new version.
Yeah. So I think I have
Did you want to comment on this? Okay.
Exactly as his story, mine is the same. Oh, okay. Steve's story is just like mine. 2012, my white blood cell count from rheumatoid arthritis went down to 1, and sent up alarm. 3 days later, I was in Methodist for 1 month in isolation and had my initial treatments there, and then to the U. My doctor had a great ego. She was able to work with other doctors. I was thrilled about that. And the University of Minnesota treated me very well. And like you said earlier, the nurses and the doctors were outstanding when I got really sick. And I got my sickest there. They were there. I may not remember their faces, but they were there. And then I wanted to talk about the DNA because I was told with my rheumatoid arthritis that I no longer had it in my DNA. I have all new blood, I have all new saliva, I have all new hair follicles. Now, that's what I understood it to be. So I have 2 DNAs, and I'm proud to have 2 DNAs, but I will not do any tests on who donated to me because I honor them for what they did, and I am so grateful. I'm here 13 years later. So thanks be to God.
Hi, yeah, we just have an online question. What information about post-BMT would have been helpful to know from the beginning, relative to medical care, psychosocial health, and spiritual feelings relative to survivorship?
We talked earlier about some of the things you have to have a caregiver early on and things like that in order to get through the 100 days. My wife's journey was lengthy, and I wish there were 2 providers that were added to her care team. So when you go to workup week, you get providers bolted onto your care. You get, depending on your circumstances or whatever, but she would get ENT and oncology and pulmonary, and I mean, you name it. She just got all these providers bolted on. I've been advocating for 2 additional providers to be added. One is a health therapist. A health therapist is somebody that can not have to work through like a diagnosis of like a mental health issue, but they can acknowledge that you are ill and that you have mental challenges because of your diagnosis, because of your illnesses. Melissa got a health therapist later in her journey, and it was fantastic. And I just wish that she would have had one at the start of her journey, especially at the start of BMT. And the other one is palliative care. Palliative care is, I think it's misunderstood that it's very close to hospice care, and they don't want to concern patients that you're going to transplant and you need to start having conversations with hospice. But palliative is designed to advocate for you and what your needs are, particularly the patient's needs and how they define quality of life. Palliative was added to my wife's care team later in her process, but once they were on her team, they would help her define what was important for her and then hold other providers on her team accountable to meet those requirements of what she had defined for quality of life. So those 2 providers early on would have been really helpful.
I will echo what Eric said there. I think, so when I went through breast cancer, my first cancer, I put my head down, I did all of the treatments, I, worked my butt off to get through that, got to the end, and everyone was like, high five, sweet, go enjoy your life, what are you gonna do now? And I just broke. I found myself feeling very depressed. I didn't understand what was going on. It was a really, really hard time for me, and recognized that, okay, I need to get somebody to support me in my mental health. Found a few therapists that I didn't love them, but it kind of worked. And then when I got diagnosed with leukemia and had to go through the bone marrow transplant, I said, I need to do this different. Because last time I did not support my mental health. I had no plan in place for that. I was so focused on my physical health that I forgot about the mental piece. So with leukemia, I said, I need to find support right away. I got support through the U. They had a fantastic social worker who worked with me regularly. And then when I was done with that and done with being in the hospital, I found a person who had medical experience outside of the U network. And I worked with her. And she's actually the one who encouraged me to then become a marriage and family therapist myself. So that was an amazing experience. But yeah, so often when we get diagnosed with sickness, we really focus on that physical health and kind of sacrifice the mental health piece. And you get to the other side of it and you just like, the world goes on expecting you to be who you once were, and you at this point in time don't even know who you are, and you don't trust your body, and you don't trust, like, the one place where you're supposed to feel safe is in your body, and your body betrayed you. And so you have this like unique problem that you have to figure out how to solve. And so finding somebody who can support you, and you don't have to say, okay, well, so with a bone marrow transplant, we have to spend 100 days in the, like, that has a working knowledge of the system is so helpful. Like I said, now that I am a marriage and family therapist, I don't often tell my clients that I've had cancer, but as I work with them and we're talking, they look at me and they go, you've had something, right? Like there's just something different about somebody who has experienced it. So yeah, that would be one of the big pieces for me is if you're going into this, find somebody who can support you from a mental health standpoint. Gosh, what else do I wish I knew going into it? I think the other piece is your doctors are going to do everything they can to keep you physically safe, right? So they're gonna say, don't go outside, wear a mask everywhere, let's minimize risk, which is important, but also, like I mentioned, my son was 3 when I had my bone marrow transplant. According to the hospital, he was not allowed to come in and see me. I said, there's no way I am gonna be in a hospital for a month and not get to see my 3-year-old kid. Not gonna happen. We gotta figure something out. And I had to really advocate for myself because I knew that part was important. I was in the hospital over Valentine's Day, and my husband brought my 2 dogs not my 2 dogs, one of them couldn't come because he would be terrible in a hospital, but he got to bring one of my dogs in to see me, and like that just brought so much, like it brought me back to life to have my dog show up. So finding those things, like if a walk is important to you, get outside, nature heals. If having your dog there is important, I hear a lot of, on Facebook I see a lot of, in different groups, and I see people say like, oh, I found out that I have to get rid of my cat, or I have to get rid of my dog because I'm going through this transplant. Like, get creative, and if you're gonna have to like break your soul to do it, then it's not the right thing for you, and you can kind of assume some of those risks. So just remember that your doctors, their goal is to keep you physically safe, but you gotta make sure that you're advocating for that mental health side as well.
Yeah, I certainly concur with that. And in my case, the medical advice I got was first rate, and they kept me well informed, and I was very proactive with questions. But the human side of it is a little different, and it's kind of a common story. I'm struck by the fact that everybody remembers when they got their diagnosis, and it started. But when did it really end? When you finished treatment? When you came out of depression? When this or that? I mean, there are no rituals or markers to kind of let people know it's now over, or there's a very clear stage you've progressed through. And I think that's where people feel a little bit adrift and not quite certain what their status is. And that's, again, the social side of it, the human side of it, which is, I think, in some ways tougher to address than the medical, technical side of it. I know one specific thing I wish I'd known earlier is the availability of peer support through Be the Match and LLS. I didn't hear about that till years later, until I became a volunteer doing it myself for others. So if there's any way to make people aware of the resources that are available, even when they're hospitalized or shortly thereafter, that might help alleviate some of those issues or get them addressed a little earlier than they otherwise would be.
We had a few more back here.
My question is about continuing health and mental health. And so the U does a fantastic job of, I think, making sure that you're getting like whole body, whole care. But then you are released from the U and you are kind of on your own to find everybody's like, get a primary, your primary handles that now, get a counselor, you need mental health. And is there a database or anything to help people find providers in physical and mental health who have experience with people who have been through, a BMT or cancer in general, so that they they know, because it's different. You know, your issues are different, and your even your physical chances of getting other things and things to look out for are different.
I can't speak to the database, but I can reinforce the sense behind your question, because I find general practitioners, doctors, often don't understand oncology in the way they need to treat an oncology patient. Just like they don't understand Alzheimer's and dementia the way they need to understand that to treat with someone like that. But in my case, I returned to my community oncologist at Methodist Hospital. I'm still seeing her twice a year. We're getting blood draws 4 times a year. And so if there are any issues that come up, she's my point of contact, and she's an excellent oncologist, and she'd know who to refer me to if she couldn't handle it. So if you have a community oncologist separate from your transplant oncologist, that's a good place to start. As for the database, I don't know.
I do. So what I would recommend, if we're talking about like mental health, Psychology Today is a great resource for that. So going on to Psychology Today, you can actually, there's a drop-down menu, and you can click somebody who has experience with cancer, and specifically will treat cancer. What I will say with that is that I would get curious about it. I would read through their bios and make sure that they didn't just click the box that, yeah, I can work with cancer, but that they have a working knowledge of it, right? Like, what is their experience with cancer? Have they lived it themselves? Is it something where they have supported somebody through it? But don't be afraid to ask those questions and get curious with them about it. Because if you are going, the best way to have therapy be successful for you is to have a connected relationship with your therapist. If you feel like you can trust them and you feel like they understand you, you are gonna get significantly more from those therapy sessions than if you feel like you are dreading going to therapy. So ask the questions ahead of time, send them messages. You can go, a lot of therapists will list their personal bios or like their website on their Psychology Today profile, so you can actually go onto their website as well and read through it. But I would always ask, what's your experience with cancer, and how are you able to support somebody with cancer? So.
The only thing that I would add is use those feedback surveys when you're in the clinics, when you're in the hospital stays. Provide that feedback. It's the only way we can really make change as well, you know, is to let folks know what we're looking for.
I'd like to thank the nurses. Amazing what you did for me. The transplant went fine. It was easy. And then I got an infection, and I was back in the hospital for a month and a half in isolation. And particularly the overnight nurses. When I was feeling good, to talk to these women was amazing. And when I wasn't feeling good, they put up with my hallucinations. I woke up one morning and my room looked like there had been a tornado. I think they worked on me all night. And I think that's why I'm here 13 years later, alive. And finally, I want to thank my caregiver sitting next to me, my husband, who came every day for the month and a half in one of the worst winters we had had before or since, really. That was a winter that he tells me, I don't know, I wasn't out, but the ice was in kind of waves on 94. So. And then, regarding the food, I think we followed all the rules, but he got a lot of stuff in. No, I don't think he snuck in. And well, I mean, I was on these bag feedings where they'd stick the stuff at 4 o'clock in the afternoon into my port, And I think that because the desire was to get me on solids, they let me eat anything. So I'm happy about that. And thanks to the nurses and to my husband.
Thank you for sharing your story. All right, I think we got him over here.
I just wanted to quickly share a resource on the kind of mental health whole person side, which is that here in Minnesota, there's a woman named Talea Dendy who runs an organization called On the Other Side. She calls herself a cancer doula. So if you Google cancer doula, you can find her. And there are a lot of other people like her who have these kind of small consultancies who can provide that kind of support, especially if traditional therapy just isn't what you feel like you need or want at this moment in time. And I am going to plug the Survivorship program just because Liz has a lot of resources that she knows about. I've been sitting here thinking, what is the name of this organization? But there is a national group that does matchmaking of like peer-to-peer support so that you can have somebody who has maybe had your same cancer or has had your experience as a caregiver and kind of walk with you in whatever you're experiencing. So I just wanted to share those two resources and make sure that that's on the table too as we talk about all the ways we can support each other through this. The second one, I'm gonna see if I can get Liz to remind me of the name. I don't remember the name, but I'm gonna look it up. But that's why I wanna plug the Survivorship program, because I know you can find it through them too, but I'm gonna try to remember the name.
Any other questions in the room? And Sharon, we must not have any online, right? All right. Just going to see if maybe our panelists, if there's anything in addition that they'd like to be able to share with the group as we close today.
So as you were sharing your story about the night nurses, I just wanted to talk a little bit more about the night nurses. So, and this kind of goes back to advocating for yourself, and for the person who was asking, like, what do you do from a BMT, like if I'm going into a BMT, what should I do? It is so important to make your night nurses your best friends, right? So your night nurse is gonna be the person who you can create that relationship with and you can say, hey, because sleep's important and it's hard to sleep in the hospital. They're coming and going, they have to get the vitals, that's important for them, but you need to sleep. And so if you can develop a relationship and a routine with them and say, like for me, I said, hey, I want to have my sleeping medication at 9 o'clock every night. Every night my nurse would come in, she'd get me my sleeping meds, and then I would make a deal with her because I always wake up in the middle of the night to go to the bathroom. I would say, hey, when I wake up, and it typically was about 4 hours in, can I ring you and you can come take my vitals and you can get that information while I'm awake, and then I can go back to sleep and get another couple hours of sleep. And that was huge for me to be able to get into a routine, because inevitably if I didn't do that, then I would get up to go to the bathroom, I would just fall back asleep, and then the nurse would come in to get my vitals and I would be frustrated. And so the more you can make sure that you're getting that sleep, because sleep is restorative, it helps us heal, and we need to stay in those routines when we're in the hospital. I hear a lot of stories of people who kind of go way out of whack when they're in the hospital and they're awake at night and sleep during the day, and all of that's hard on our bodies. So we have to make sure that we're doing everything we can to keep our bodies healthy and safe so that we can recover as quickly as we can. So become BFFs with your night nurse. Let them know what you need and what's gonna work best for you so that you can get that good sleep and restore and heal quickly.
I struck pretty much the same deal with my nurses. Let's do the blood draws, the medications, what else is it? What am I missing? You know, all that stuff. The one I never understood is why do they empty the trash cans at 4 a.m.? I think you could do that at a better time, but it's not under my control.
Well, I want to thank everybody today. Thank you for sharing your stories. Thank you for all of you for this great conversation that we had, and also for sharing your story today too. We do need to wrap up our panelists today. I do want everybody to know that we will conclude the Survivorship Conference today out in the Memorial Room with Dr. Wendy Hartman. And again, this is just going to be able to provide a little bit of humor and joy to be able to end your day. And again, thank you for being here today. Take care.